Thank you. Apologies for absence. Ms. McCarthy, have any? I'd apologize to the AG, who is tied up in another meeting where legal skills are required.
Chairman, apology for Senator Scott Motley, who is not going to be with us today. And I did ask my friend, MP Paulwell, to apologize for my lateness.
He'll be a bit late.
I'm apologizing for his lateness.
Yeah, I think Member Paul will be a little bit late, he assured me. He's doing he's out in Wisconsin, will be coming in a little bit later. So we look for that. And Senator Sinclair sends apology. He took the vaccine yesterday, I gather, and he's having some mild side effects. I'm not sure what caused the side effects. I'm a physician because the number seem to have, nothing happens. Others seem to get quite a viral reaction. Because I mean, I know saw the challenge when they said the prime, they were sure you took it, but I got the stick, I didn't feel it. And I literally asked afterwards whether I gotten it because I didn't even have another side of anything. But I hope I've developed some immunity. I'm going to ask the clerk to send to the House leader that we can have some of the meetings virtually. But I know that today we're having one of the principal presentations from the Planning Institute, and I know they want it would be. I have an idea what some of it looks like. I think it would be good to see it in person as we can. We're going to the budget debate, however, which means sectoral debate. The House will be again tied up. We do have a parliamentary facility which is still doesn't have enough space for everything. So we can do some virtual meetings to try and get this particular piece of legislation back, amended as is required. So we should have a few meetings going forward. I think a couple of Wednesdays have been deleted already from the dates I had scheduled. But we still have Thursday the 15th and 22nd that is available. We'll try to get in some more dates and still try for the virtual presentations. We haven't got the minutes. We'll look at the matrix another time. We want to go through the presentations. So let me welcome all the teams right here. I think we have the Planning Institute beside my colleagues. So some will be late, but we had the Planning Institute today. We're led by Dr. Henry with Mr. Charles Clayton and Mr. Charmian Brim, who will give us an outline of some of the issues affecting the area we're looking on. We have, I understand, the United Nations Development Program, UNDP, Ms. Carla Watson-Williams. Welcome, Ms. Shelley Ann Forrester, and Mr. Nika Gray. I see your names. Good to have you. And of course, we have the Violence Prevention Alliance. You know, this term is almost synonymous with two names, which I see those. So I'd love to see Ms. McGaw, Mr. Brown, Ms. Brown, and Ms. Weeks. Yeah. All right, that's let me get them, Ms. McGaw, and Ms. Brown, and Tarek Weeks. Thank you. Welcome. Please accept my apology for when I say VP, I just say Elizabeth Ward. Right? Her name is synonymous with Violence Prevention Alliance, which has done outstanding work. So we look forward to your presentations, but we're going to begin with the Planning Institute of Jamaica. Welcome, Mr. Powell. All right, coming in from the east. All right. Everything went well? Yes, I know part of what you're doing is trying to contain the violence. We all see. No, we have got some good police officers all around, and they're working hard, really. We need some more. We're looking to see how we can train them, but train them properly so they do come and follow the philosophy. Let's see. No, we don't take them in. We just do the matrix at a later stage. We take them as read. So I'm going to go straight to the presentation. POJ, Dr. Henry, and Mr. Charles Clayton. Want to get any?
Chair, I'm sorry, I had been in another part of the building, but just to let you know, Senator Charles Sinclair sends apologies. He did, okay, great.
The vaccine and got himself a little bit off key. So we're going to invite Dr. Henry to initiate. The Planning Institute have been working in this kind of, well, with zones of special operation is a term to be applied to particular communities, and the POJ has been at this for some time. I think with the start with the community renewal program, when you start to identify particular communities in Jamaica which had a higher than normal incidence of violence. I don't consider violence really normal, but particularly high incidence in about 100 communities scattered across 4 parishes in particular. The corporate area counted as one. 5 parishes is what they call it, 4 zones. And has been seeking to get programs working in these areas. So they have a wide and extensive body of knowledge, and both physical and otherwise, of the issue of criminal violence in these communities. So we'll look forward to their presentation.
Thank you so much, Chairman, and good afternoon, Chairman and members. And we were invited to speak a little bit about the Community Renewal Program, the CRP, as the Chairman said, and to give an overview of how we determine the communities in which we operate. I'm joined from the PIOJ by Mr. Charles Clayton, as you heard, who is a Program Director for the CRP, as well as Ms. Charmaine Brim, who is our Socio-Economic Development Specialist with the CRP. So the CRP was established late 2011, and we've been doing quite a bit of activity. So I'm going to hand over to Charles and Charmaine to do the presentation.
Thank you very much, DG. Just by way of background, the CRP, Community Renewal Program, as was said earlier on, was established around about the latter part of 2011, and it came into being as a response to the concerns raised after the social unrest of 2010. The idea was to look at the underlying conditions that could have given rise to that kind of response, and to see if an appropriate program could be implemented that could deal with it. Based on that, we determined through consultations with a wide variety of experts and public sector, private sector, academia, and others, that the focus should be on what we consider volatility and vulnerability. And from that perspective, the parishes that had sustained the highest level of murder and violence, shootings and so on, over the previous 5 to 10 years should be the focus of the program. On that basis, a mechanism for selecting those communities which relates to volatility and vulnerability was selected. And then it was determined that a program was needed, not that would overlap with the other implementing entities, but one that could bring focus and coordination to the process to prevent overlap and to ensure a more targeted approach towards intervention. So our focus was on data collection and on presenting information that could guide in that process. So as a preamble, my main presentation this evening is going to be on 2 things, just to give a 5-minute clip on what the CRP is, and then to say very briefly through our PowerPoint presentation how we came to select the 100 communities that form the focus of the CRP. So at this time, I'm going to ask the technician to just play that video clip, which says succinctly what the CRP, how the CRP framework works.
designing and supporting best practice interventions, monitoring and evaluating, and researching and analyzing data to provide information for better program design. To strengthen the F&E capacity of the Community Reward Program, a web-based monitor and evaluation database was introduced in July 2020. This system is intended to be used by CRP implementing partners to plan, track, measure, and report on the performance of interventions under the CRP umbrella. Another component of this system is an online platform which will become available in early 2021. This platform will provide data and information on certain target communities, interventions, and results with a view to promoting evidence-based decision-making among stakeholders. Coordination and collaboration among the agencies within each parish is facilitated by the Parish Interagency Networks established by the Social Development Commission. The ultimate purpose of the CRP is to contribute to inclusive growth and equitable national development by fostering the socio-economic well-being and enhancing the quality of the lives of the residents of volatile and vulnerable communities. Here's Charles Clayton as he explains our theory of change. The CRP recognizes that agencies working by themselves in silos are unable to accomplish the kind of change that is needed in the spaces where we have social problems of the kind that we are facing. So if we expect communities to be able to be transformed and improve in spaces where people can operate in mainstream societies, then we have to be more targeted in our approach. We have to target the issues that we deal with more definitely, and we need to work together in an uncompeting kind of way. For more information on the CRP, visit the PIOJ's website or email us at info@pioj.gov.jm.
Thank you. That's just an overview of what the CRP is intended to do. We have other data which would have calibrated how we have moved over the years, and we have developed additional tools such as the Community Renewal Index. But today we're just focusing on answering the question, which is to say how the top 100 communities were selected. Sorry, Minister, you were saying? Oh, thank you.
Yeah.
All right, so now I'd just like to go through the slide just to say how the top 100 communities were selected. And to start that process, we pulled together a team of experts from the public sector, private sector, the academia, and from the communities to consider what were the factors that should be taken into consideration. And on that basis, as I said earlier on, we determined that we needed to look at what we call volatility and vulnerability. On that basis, we looked at some of the criteria that we thought were critical to that. Oh, I'm controlling this thing. So, right, so on that basis, we looked at some of the criteria that we needed to consider. We looked at the level of crime, focusing primarily on murders and shootings. We looked at the level of poverty, teenage pregnancy, literacy, and we couldn't get community level data on adult literacy, so we focused on grade 4 literacy, which was available. We looked at the number of ex-convicts present, the accessibility of communities to services, level of child abuse, violence-related injuries, presence of gangs, and the presence of squatter settlements. And all of those factors were weighted equally except for poverty and gang presence. Poverty was weighted less, simply because there's no direct correlation between poverty and violence, even though poverty may contribute to the factors that may lead to violence. So that was rated a little lower, and gang presence was rated a little higher because the presence of gangs is a more contributory factor, better predictor of violence than anything else. Sometimes the violence doesn't occur in the communities where the gangs are, but they will contribute to violence elsewhere. So the focus on gangs give you a better idea of whether or not volatility is likely to be present. So apart from those two factors, each of the other factors were given equal weighting in the development of the index. So the selection process involved the collection of data using secondary data from agencies that generate this information. And it involved also mapping the data to correspond with the community spaces that we were looking at. We overlaid this data on the communities, all communities within the 5 parishes that had been targeted. And on the basis of how the data mapped out, I should say before that the whole entire process, data entry, was a collaborative effort between agencies. Some were responsible for data entry, some were responsible for contributing data. But at the end of the day, a table was generated that actually laid out the indicators, how they actually mapped in relation to each other. And on the basis of that, we came up with rankings for, I'm wondering if I'm going in the right direction. I'm trying to get to the table here. Oh yes, we're here. So on that basis, we came up with rankings for volatility and vulnerability relating to all the communities, and an overall all variables ranking. And when we checked on the rankings, we looked at those that scored the highest for volatility and vulnerability. And by mapping all the variables, we came up with what we call the top 100 communities to be selected. The rest of the table actually shows at that time which communities ranked as the top 20. But those communities are no longer all in the top 20. So subsequent to that, we went through a process of data consideration with the JCF and the Ministry of National Security, looking at all the communities where a pattern of violence has developed. And on that basis, we added communities from Westmoreland and Hanover and ranked them along with those that had already been selected, the top 100, and came up with another top 20, which is not here shown on this list. But this is simply illustrating how we came up with the first top 20 that was used for prioritization. So I'll skip that and just show you the mapping to show how they cluster around particular spaces. And if you can look at this map now, you can see how the darkest shading represents those that were most volatile and scored the highest. And you can see how they cluster around the Kingston and St. Andrew area, almost mapping the coastline going around. So this was the basis for our selection of the top 100 communities. And whereas some have moved and are improved in their condition, the general idea is that unless the underlying conditions change, any one of these communities could break out into violence at any time. So you'll see it moving around from community to community, depends on the dynamics that are taking place there. So they all remain communities that we need to focus on. However, the top 20 that I mentioned, which are not listed here, are based on current data relating to volatility, that is the number of crimes committed and the presence of gangs primarily. So that in a nutshell is the information on the top 100. Thank you.
That's it. All right. I'm sure there are a lot of questions to be, wish to help on. Maybe we should do is, I think there's some documentation that was circulated last week, and rather than start the debate, we could get the UNDP presentation, and then we take some questions, and members can make some notes, so we can take the questions right after. I want to thank the POJ for their presentation. I think quite a few interesting things to look at there. What I'd say to the PIOJ, maybe one of the spin-off of all this ZOSO discussion, not just the communities we are going into zones of special operations, but you have renewed attention to the work you have been doing for some time, because I think we did this back, as you said, back in 2009 to 11, and we have not really had the focus of attention that we should have had on the communities. And rather than see them reduced, I think you may have added a couple of communities in the mix when we do the current analysis. And that's one of, although we are focused on the particular piece of legislation that deal with specific communities, what we have to do is look at the entire areas that are affected, because we are looking at reorganizing our whole investment program in the social challenge areas to ensure we can begin to impact meaningfully and the lives and quality of life in these communities. But we're going to take the UNDP and then we take the questions since these are, yeah.
Chairman, I'm just seeking one clarification because I know that there must be some working relationship between the PIOJ and the CSJP program. Is that so? Because they do also have started with 100 communities. Did you interface? Did you work together? And I just want to understand the relationship between the two organizations.
Yes, we worked with existing programs. As I said before, we are not an implementing entity. What we tried to do was provide information that could guide where they target, the spaces they target, and the types of things that they did. So we collaborated in particular interventions from time to time, and they tried to see how they could map their programs around those spaces. But as I said, the main intent was to have a clustering of activities in single spaces so that all the issues can be addressed at the same time.
I'm going to ask them to state the UNDP member part, because one of the things that we're trying to, you might have seen the document to circulate for MNS, is while we'll have special projects zeroing in like zones and specific communities, CSJP, JSC, etc. One of the things I'm trying to look at in a policy is to look at what assets we have in all of these communities and begin to optimize the public expenditure and to what extent we can drive some more programs that really impact on all of the communities. And we'll do this. So we'll hear from the UNDP, and I'm going to ask Dr. Henry to have his team stay, because the kind of discussion we're having is really need to share the knowledge, right? So it is Miss Williams?
Yes.
Okay, go ahead.
Good afternoon, Chair and members and colleagues who are here. I am making a presentation on behalf of the UNDP today, and with me is Shelley-Ann Forster and Anika Gray, both from the UNDP as well. And our presentation focuses on changes to the ZOSO, but looking specifically under the aegis of the Spotlight Initiative, which focuses on violence against women and girls. And so we are looking at recommendations for amendments to prevent violence against women and girls and to protect women and girls in the zones from violence. We know that the law, this particular bit of legislation, supports the government's crime fighting strategy of clear, hold, and build, which emphasizes the root causes of violence in our society, alongside the important work of establishing and maintaining stability and security in volatile and high crime communities. In our contribution, we are particularly concerned with the build aspect of the strategy as supported by provisions of the Act to establish and prescribe the duties of the Social Intervention Committee. And specifically, we're recommending a revision of the membership of the Social Intervention Committee, as well as including provisions which focus on preventing and responding to family violence and gender-based violence in the ZOSOs. But we want to speak a little bit before we continue about sexual exploitation and abuse and sexual harassment by the joint force. Since our concerns fall within the area of violence against women and girls, we know that research done by Dr. Herbert Gale and the Violence Prevention Alliance, we know from that research that women in high crime communities have said that while they feel safer with the police presence in their neighborhoods, they're disturbed by the high levels of sexual harassment by the police. And we have cited the study for your reference. And we know that the situation is not unique to Jamaica. The UN itself has been grappling with issues of sexual exploitation and abuse and sexual harassment by its own peacekeeping forces in several countries. And there have been numerous reports about sexual harassment and sexual exploitation and abuse of women in communities which are under the control of security forces across the globe. So by sexual exploitation and abuse, we're referring to crimes like rape, but also to violations we believe will apply, but also to violations of any ban on sexual relations that include abuse of a position of vulnerability. And we believe that this applies to the residents of the ZOSOs because poverty, conflict, and chaos all make women, boys, and girls profoundly vulnerable to sexual abuse, exploitation, and harassment by the security forces. So we're recommending changes to Section 8, subsection 2 of the Act, which sets out the qualifications of members of the Joint Command. Under that section, in addition to their training as members of the JDF and JCF, the Act requires that they have training in human rights, the use of force, and community development initiatives. It is our submission that that section be amended to require that the Joint Command and Joint Forces have training in the prevention and mitigation of sexual exploitation and abuse and sexual harassment. And additionally, we're recommending that the Act mandates that this training be by an approved provider, and it becomes part of their preparation for deployment in the zones. The Act under Section 8, subsection 3, further requires that each zone has a written accountability and reporting system, and we are recommending that this system should include data on any reports of sexual exploitation, abuse, and harassment by the joint forces. I want to move now to looking at sections 23 and 24 and the first schedule of the Act, which lays out the Social Intervention Committee's composition and mandate. So, Section 23 establishes the committee, and the duties are laid out in Section 24, and the membership is laid out in the first schedule of the Act. So our specific comments relate to the duties set out under Section 24 and the membership of the committee. So we note that the committee is mandated to carry out several functions. Among these are assessing conditions within the zone, including physical infrastructure, health, housing, what you would refer to, Mr. Chair, as the assets of the community, identifying threats to the sustainable development of the communities within the zone, developing a sustainable development plan to address the issues identified by the assessment, including the Act specifies issues of economic development, education, health, etc. And the committee is also to recommend social interventions within the zone, including, specified again in the Act, compulsory school attendance and urban renewal initiatives, among others, and to coordinate the implementation of recommended social interventions. We note, however, the absence of any mention of the issue of violence within the family, and in particular, violence against women and girls. We consider this a key matter which needs to be specified in the issues to be addressed in the Sustainable Development Plan developed for each zone, and around which urgent interventions should be implemented. And we consider this because family violence, we know, has far-reaching consequences which extends well beyond the victims themselves. And in many ways, family violence is a precursor of generalized violence. So hence, any attempt, we believe, to address the issues of crime broadly and violent crime in particular in these zones must be anchored in an understanding of the synergy between the violence that takes place in the family and is perpetrated in particular on women and children, and the violence that takes place within the community. And we have here in our presentation laid out a bit of research that shows that men who beat their partners also assault their children, and children who suffer or witness abuse become more likely to use violence as adults. We know from our own data in Jamaica that abuse has persistent intergenerational effects, with men who have witnessed their mothers being abused being more likely to become abusers as well. And the pattern holds for women as well. What we know is that women who saw their mothers abused by their own partners also are more likely to become victims of partner abuse themselves. Violence in the family and violence in the community, we submit, have a symbiotic relationship. One normalizes the other. So And we looked too at the use of violence to discipline children. And that has also been linked to interpartner violence and other types of violence in the household. The use of violence to discipline children set them up to become violent adults. This has been confirmed by a litany of research conducted internationally and in the Caribbean. So the data suggests that child survivors of abuse are more likely to display different types of violent behavior later in life, including violence against their own peers and violence against their partners, and bullying and things like teen dating violence and so on. And I won't go through all of this, but you have it in the written submissions we have, where we looked more closely at some of the other research in the Caribbean that showed that the presence of domestic violence in a household was associated with risk of deviant behavior, including sexual abuse, of household members. And in Barbados, another study revealed that almost 30% of youngsters who were presented to a court were documented as coming from violent homes. And we see this research, similar findings being repeated in research in the Bahamas. So based on the evidence, we believe that family violence, in particular violence against women and girls, is a strategic entry point for efforts to reduce violence more broadly, because the family, where the vast majority of violent acts occur, is where habits and behaviors are formed for successive generations. Prioritizing programs that aim to stop violence in the home before it occurs may also have a broader long-term impact on overall societal violence and criminality in Jamaica. It must be obvious that preventing violence in the home against women and children can stop children from growing up with increased aggression and emotional problems, which may in turn prevent them from delinquency and violence later in life. In a context where the children of 44% of women who have been abused have witnessed this assault on their mothers, sometimes repeatedly, it is critical that we acknowledge the complex link between violence against women and girls, especially in the family, and the reproduction of violent criminals in our toughest communities. This link is further strengthened by evidence which points to a high degree of correlation between the ideas and expressions of masculinity and violence in the Caribbean, including in Jamaica. And we cite in our presentation a 2012 study which looked at the links between models of masculinity and violence against women and girls and general violence in the region. And what it found essentially was that the way young men felt about what manhood looked like influenced their attitudes and their engagement in violence. And it says that the masculine stereotype damages the development of boys' emotional intelligence and their capacity to exercise self-discipline and self-control. As a consequence of the belief that they need to be aggressive and exercise power in relationships to prove their manhood, they tend to resort to violence as a first option. While most say they reject the use of violence against women, many feel that it is necessary to discipline women in certain circumstances, including when they feel insecure and need to show their own power and control. So, with all of that, Mr. Chairman and members, we are recommending that the joint force include a focal point on gender-based violence, violence against women and girls, because under the existing law, and there is precedence for this under the existing law, already one member of the joint force is designated an attendance officer and a prescribed persons for purposes of the child protection. That is section 22, and we're suggesting that a similar designation can be made for family violence, gender-based violence, violence against women and girls. We're also recommending that the committee include specifically a representative from the Bureau of Gender Affairs, the Institute of Gender and Development Studies at the university, and an NGO providing services for survivors of family violence, and perhaps also the Victim Support Division from the Ministry of Justice. While we note that the minister has wide discretion to appoint persons to the committee under Schedule 1, given the prevalence of family violence and violence against women and girls, and its centrality to addressing overall crime, it is important for these organizations to be specifically listed in the legislation without having to rely on the minister's discretion. That is our recommendation. We're also recommending that the duties of the committee should specifically include an assessment of the level of vulnerability to family violence in the zones. This assessment should examine the extent to which women and children are exposed to family violence and gender-based violence more broadly, as well as the services which are available to support survivors of this kind of violence in the zone. The committee we're recommending also should be specifically mandated to commission the implementation of a family violence or a gender-based violence prevention program in each zone. And this can be wrapped up in the Sustainable Development Plan, which we think should also include provisions to increase access to family violence services to residents in the zone. And we also wish to submit that this Sustainable Development Plan should expressly include intervention programs focused on producing nonviolent masculinities, given some of the background that we had shared before. And the categories of vulnerable persons under Section 24(1) and 4 should be expanded to include women, gender non-conforming people, sexual minorities, the homeless, and people living with HIV. I want to just conclude by drawing attention to the National Strategic Action Plan on Gender-Based Violence. And in that plan, it makes the point that due to the complex interrelation between gender-based violence and gang violence, national security issues aimed at eliminating gang violence should have a gendered perspective, and therefore placing gender-based violence front and center as a national security issue and not as an addendum to national security issues, but integrated in national security issues. So I want to thank you for listening to us, Mr. Chairman and members, and that ends our presentation.
Thank you very much, Ms. Williams, for your UNDP presentation.
Clarification, Chairman. Just a little clarification.
Yeah, I'm going to, no, I just want to say that I don't think I've said anything that we can disagree with. Yeah, and I appreciate the way you have approached it, because you have pointed out specific areas of legislation, which is what the committee is all about, that we need to make amendments to. I only have one question, but I'd allow the senator to go first. And I'm going to, I was saying,
to ask, Chair, that at the 7th recommendation on page 6, you spoke of gender non-conforming people. Are we talking transgender? Just help me to understand your language here.
So I'm not really referring specifically only to transgender, but we're referring here to the LGBTQ community generally, not just transgender.
I thought that's what you meant by sexual minority, but then I may be wrong. Yeah.
We may have overstated it.
No, I said the only comment I'm going to ask the state that we take the VPA, since all these recommendations that I'm imposing too much time and you're here with you're here with limited time, but I'm going to ask to stay and await the presentation on VPA. But I only comment, I said an excellent presentation, and for me not to misquote, let me repeat that. And you have made some very sensitive and important points, and certainly things like the sensitivity of the security forces to violence is something that we have tried to do. And, we have to keep a 360 view. And I think you'll recall that as far back as 2018 first in the ministry, we stopped construction on police stations to have them change the reception area of the police station. Rebrand them from guard rooms to reception areas, and in fact, designed all the new stations, repair stations, and patients being repaired. Proper reception areas where individuals can go and have proper interviews. So it's not something we are insensitive to or that we don't wish to. And the more suggestion we have to make it more user-friendly and to make the police force more sensitive to violence, and in particular gender-based violence, we are there. But I've always had discussion with my minister in gender affairs that every time we discuss gender violence, the question of how we approach our young men is an addendum. You take the opposite view of this, and the fact is that the violence, the perpetrators, if we reduce the perpetrators, we don't have a problem. In fact, if we have nobody perpetrating violence, then there's an issue. And I find it's something I feel very strongly about, and I get very little response because, I mean, maybe my own person is that we have socialized women, not just into masculine, to be violent. And we can provide all the legislation and all the prisons and all the police sensitivity. If young men decide to slaughter each other and know their turn and they kill some women in the process, it's going to continue. And I get very little support from the academia. In fact, with Dr. Gale, maybe the exception, who was recently taken to study of violence as a particular topic. But the general comment is always gender for women and children. But it's the men who are beating them. And what do? We have to correct the socialization and the education of our men, because they were from slavery, converted from black males to mandingos to be studs and beaters of, and you know, they're just dehumanized. And in many ways, we have perpetuated elements of that kind of society into the modern times. And I don't think we pay enough attention to it.
Minister, I just want to say in response to that you're right, sort of. Because it is a very important issue, and I think that's why here, when we looked at the social intervention, the Sustainable Development Plan and the social interventions, that we said that there should be a particular prevention program looking at the creation of non-violent masculinities. And so while it is true that gender-based violence is largely perpetrated by men, it isn't only men who live in the communities such as are covered under ZOSOs that perpetrate gender-based violence. And so that's why I added the little sort of. Because it is true that these communities, in fact, you know, when we did the Women's Health Survey, we oversampled in the communities covered by the Citizen Security and Justice Program, because we wanted to know if communities that had high levels of generalized violence had higher than national levels of intimate partner violence, and they didn't. They didn't have any higher level than you found in other communities.
What they're saying, that the males in our society, I mean, so, and it doesn't matter whether they're downtown or uptown or midtown, basically. The attitude, the education, the miseducation of men in Jamaica is a systemic problem. And we get very little comment on it. You say, you know, I mean, all the suggestions I've made, I think 90%, most of them may be adopted, because we see the need to always increase in the sensitivity and the protection of women. That's a Jamaican culture, but we see to get rid of it, we somehow have to look again at how we socialize. I mean, this is long-standing in rural Jamaica. Send the girl to school, send the man go do something to plan the farm work. Then you get onwards, girls go to good schools, get taught good table manners and all the kind of nice ladies. Men must show they must be tough. I mean, we have to spend more time on looking at how we deal with them, and so we're today where they find the power of the inner city young man come from a barrel of a gun. He's feared. That's his power. Anyway, I don't want to spend. We're going to have to discuss the committee. Huh? I'm going to ask the VP. Go ahead.
Are we going to do questions after this?
Yeah, we're going to take the questions. So a short break. I'm just going to take all of them and say, make note of your questions. I have Miss McGaw, Miss Brown, and Miss Weeks. I know we have a dominance of women on this side. Who's going to do the presentation?
Thank you, Chair. I'll start. Good afternoon, everyone. The Violence Prevention Alliance is pleased to be here today to have the opportunity to make a submission to you all on the review of the Law Reform Act. Before we start, I'd just like to introduce you to the team. My name is Safri Brown. I am a social and local development practitioner with too many years in the field. I won't say how many. I won't age myself. My area of expertise is on sustainable development, and more specifically on models for sustained social change. This has meant that much of my work has looked at new ways of delivering social change, with a focus being on sustained impact and impact measurement. Also here with me today is Kayode McGaw, who will be presenting our recommendations shortly. Kayode holds a double master's in public health, specializing in epidemiology and biostatistics, and has worked in violence prevention for about 5 years, and has extensive experience in quantitative research, translation, and project management. And finally, Tariq Weeks is a research fellow in UWI's Institute of Criminal Justice and Security, with a focus on gang activity and safer spaces. Tariq also consults with international researchers on citizen security program design and development. And so a little bit about the VPA, for those who may not know. The Violence Prevention Alliance is a network of World Health Organization member states, international agencies, and civil society organizations working to prevent violence. Locally, some of our alliance members include the Ministry of Health, the Ministry of National Security, the Ministry of Education, Youth and Information, Mona Geoinformatics Institute, the Manchester Peace Coalition, the Nurses Association of Jamaica, the University of the West Indies, and many, many more alliance members. More specifically, the VPA, through this network of alliance members, utilizes a data-driven, evidence-based approach to violence prevention by supporting the promotion of primary prevention of violence, integrated community development and public education, increasing collaboration and exchange of information between organizations on violence prevention, and lobbying for the integration of violence prevention into all social and educational policies, thereby enhancing the promotion of gender and social equality. This has involved defining the violence-related problems to be addressed, identifying the protective and risk factors, developing and testing prevention strategies, and assuring the adoption and implementation of best practice prevention strategies. The Law Reform Act at its core seeks to improve levels of citizen security within specified high-risk target areas. Security vulnerabilities in many of these communities are due to the limited opportunity and lack of access of community residents to lawful social mobility. Over the past 50 years, the reality has resulted in the evolution of deviant behavior and a culture of community violence, which has crippled and underdeveloped our Jamaican communities. Therefore, measures to address crime and violence must prioritize social and community transformation, and it must do so through community-led and community-owned processes. As with most area-based security interventions, concerns about the method of addressing antisocial behavior and criminality while limiting excesses of the state on constitutional rights is of paramount importance. There are other concerns regarding cost-effectiveness, cost-benefit, and sustainability. And sustainable and sustained development should be the priority of these efforts. Earlier this year, the VPA consulted with a panel of experts in academia, public health, the legal fraternity, citizen security, and community violence prevention to inform this review of the Law Reform Act 2017 and provide feedback aimed at strengthening the capacity of this legislation to maximize real and sustained violence reduction. I'm going to hand over now to Kayode McGaw, who will go through what our findings and recommendations are, or really our recommendations.
Thank you, Safri, and good afternoon, everyone. So Safri has given us a brief introduction to the VPA, and I'm going to go ahead and further introduce how the VPA defines violence and the problem of community violence in Jamaica. I'll then lead into our recommendations for the Law Reform Act, and I'll finish with some concluding remarks. So after the call for submissions, the VPA consulted with a panel of experts in academia, public health, citizen security, as well as with representatives of local community-based organizations. And there were three main themes of feedback which we received. One is the importance of addressing antisocial behavior and criminality, while also balancing that with limiting excesses that would infringe on a person's own constitutional rights. The second theme was about the cost effectiveness and sustainability of the ZOSO. Thirdly, we talked about the prioritization of sustainable development as a main tenet of the ZOSO. So why should we prioritize sustainable community development? Well, at the VPA, we believe that community crime and violence are really just symptoms of larger societal and environmental factors, and I've heard that sentiment echoed today by UNDP and PIOJ. So we really acknowledge the reason that we see these variations in the rates of crime and violence across our communities in Jamaica is because there are these underlying conditions that differ greatly from one community to the next. And when we look at the international violence prevention community, they use what's called a socio-ecological model for violence perpetration. And it's it's a method of defining the various levels, the individual level, the relational level, the community level, and societal level, the different risk factors on each of these levels that actually increase or can decrease a person's likelihood of committing acts of violence. And I'll just explore a few of these risk factors. Starting on the individual level, sorry that you can't see it so well, but on the individual level here, we see that many of these risk factors were mentioned earlier by UNDP. We know that individuals who are exposed to violence, and that's either as a witness of violence or as a victim, we know that individuals who have low educational attainment, are unemployed, have substance abuse issues, or are exposed to family dysfunction are more likely to carry out acts of violence. On the relational level, which is really looking at your immediate relations, for example, your parents, your peers, we know that individuals who have violent parental conflict in the home are more likely to perpetrate violence later on in life. Individuals who have poor parent-child relations and are associated with delinquent peers, also we see that increased likelihood of violence perpetration later on in life. There are even factors on the community level which we know increase an individual's likelihood of committing violent behavior. Communities with high levels of poverty, higher unemployment, higher social exclusion, and this is not an exhaustive list by any means. I'm just showing a few of those factors that we know make communities more violent. And on the societal level, having higher income inequality, we know contributes to higher violence. And this is because of the barriers of access to lawful social mobility that result in persons resorting to unlawful activities. We also know that societies that have more pro-violent social norms also have higher rates of crime and violence. And all of this is really just to say and emphasize the point that Safri echoed earlier, which is that we want to address that with any security measures that are being implemented, social and community transformation must be at the heart of all of these measures. So now I'll move on to our 5 main recommendations. So our first recommendation is positioning ZOSO as a force for economic development and not one of mere suppression. So this was a point built on from earlier on, where we want to really emphasize that sustainable development should really be the priority of the ZOSO, and it's being backed by these security interventions. And the benefit of this is that when communities know that this effort is one to develop the community, you're going to have greater citizen activism, higher engagement in the citizens themselves protecting their own livelihood and security. And this leads to more sustainable interventions. And when I say sustainable, I mean interventions that are co-owned and co-developed by the community themselves. And in addition to sustainable, we also want sustained interventions. So these are interventions that will last for the long term and be reassessed in terms of how maybe the dosage of the intervention can be changed at a later date. But we really want these interventions, they will have to be long-term investments. So here I just have a community transformation model, and this has been designed by the VPA in partnership with some of our alliance. And it really defines how do you get a community that is in crisis into becoming a safe, just, and sustainable community. And this has been created from the experience of VPA working with several of our local partners. When you have a community in crisis, the first step is really interrupting that community violence. And that can be done by a ceasefire or peace treaties to immediately go in and reduce the levels of the immediate threat of violence, followed by therapeutic camps, counseling, engagement, and mediation. And we really see the importance of counseling as a way to interrupt retaliation. The next step has to be healing and reconciliation, and this will really involve people who are involved in the violence. And under this, we look at improving literacy to improve cognitive abilities. We look at small income earning projects to divert people away from more unlawful methods. We encourage community sports and arts, and also the renovation of green spaces so that those green spaces can be reoccupied by the community and not left as a vacuum for other criminal activity to take place. The next step we see is community governance structures, and this goes back to what we spoke about earlier about the community owning and being part of the development of the transformation of their own communities. And here we see the importance of peace councils, we see the importance of community engagement in the development planning of the community itself. Finally, for community sufficiency, very important that we have sustainable economic activity in these communities, and that involves literacy programs, infrastructure projects, skills training, job placements, microenterprises, and also microfinancing. So after the first stage of interrupting that violence, this is not a linear model. It's really several stages can be done simultaneously once that interruption has taken place and that immediate threat of violence has been resolved. So this leads to my next point, which is measuring and defining benchmarks for success. So how do we define a successful ZOSO? What are those indicators that tell us that this has been a successful security measure? We really want to advocate for transparent and easily understood measures of success, and also greater detail in defining the stages of the ZOSO framework. Similar to the model that we showed earlier, it's really about showing how do you get this community in crisis to one that is just, safe, and sustainable. We also see it as important that there be criteria for exiting any ZOSO community. What has to happen in order for the ZOSO to safely exit, and what is the exit plan, and how is it defined? So these points really all are about greater measurement and definition of how we classify the success of ZOSO. One second, trying to. Oh, okay. Right, and our third recommendation is about the robustness of the Act. And by this, we find it very important to outline the specific tools or methods that will be used to, that will be utilized with suppression, interruption, and prevention. Currently, as the Act stands, this is left up to the agencies to decide, and we think it would be best to define these tools and methods in the Act itself. We also see it as important that the framework for focused deterrence should really include other criminal justice and social work actors, and that this should not just be left up to the Joint Command. And the wider framework of actors should really be included in this Act. Thirdly, oversight mechanisms are important as a point of reference for citizens who are seeking redress, and citizens should be made aware of the oversight mechanisms that exist so that they can utilize this to their benefit. Oops. And for a fourth recommendation, we say here that there's no broad brush for suppression, and what that really means is that different communities are going to need different approaches. So here we recommend that the criminal opportunity choice models be used in the ZOSO approach to assess how Denhamtown might have different needs in terms of methods of suppression compared to, say, Augustown. Further, we notice that particularly for Denhamtown and inter-community conflict that exists between sections of Denhamtown and Tivoli Gardens, that these type of more complex situations need more consideration. How do we define the boundary for a ZOSO, and how do we do it in a way that considers neighboring communities and inter-community conflicts? So our last recommendation is in reference to the Social Intervention Committee. We see that the Social Intervention Committee plays a very important role, and what we want to do is give it more structure and more strategic direction. We recommend that the PIOJ should be given license to guide the development process. We believe that a situational analysis must be done and that a team would be put in place with the requisite skills in order to fulfill this role. We see it as important that this will give the community a clear strategic direction, and that critical success indicators should really be identified so that you can evaluate the success of these social intervention committees. JPs in the Act also play a very significant role, and there's a need for identification of specific JPs who should be trained and sensitized about the roles and the support that they provide. We also believe that a roster of these JPs should be available at the relevant holding and detention centers so that they can be accessible to the community. So wrapping up, I'll just reiterate our recommendations. Firstly, we believe that the ZOSO must be a force for economic development and not one of mere suppression. We believe that transparent and easily understood measures of success should be defined. We really advocate as well for wider inclusion of criminal justice and social work actors, and that the Social Intervention Committee should provide an in-depth and specific assessment of the challenges for each ZOSO community. We also believe that the ZOSOs must consider the inter-community conflicts that exist so that these boundaries that are derived can consider the dynamic situation happening on the ground with our communities. So thank you so much for listening. We look forward to your comments and feedback, and thank you for listening to our recommendations.
Thank you very much. It was Miss Brown and Miss Weeks, is it? Right? Thank you. From the Violent Friends said
Mago.
From the VPA.
Yeah.
And Mr. Weeks.
All right, you have, members have heard the submissions from the three teams here, may wish to ask some questions. Now, on your own, general comment on your own presentation from VP, of course, one of the, not quite lightly, but I have in discussing crime and violence, we all use the same language, but oftentimes we get to deal with mean quite different things, right? You know, and that's one of the issues that they have to maybe, it's difficult to resolve it in social issues, but if you take your community transformation model, I don't think there's, I certainly think the PIOJ and certainly the JSC and the Ministry of National Security Crime Prevention Committee and a number of other committees, the same thing you wrote at the top, consistent, safe community, ceasefire, safe community, they only use the word ceasefire. I find that a bit jarring because I talk about ceasefire in a national community. I really can't accept that I need to negotiate a ceasefire. I've never done one of Australia, and I represent one of the most violent communities in Jamaica because I don't believe it's right. I don't see why a community should talk to people who are firing guns at each other between communities. But safe community is something that everybody uses. Community building activities, community development, community sufficiency. It's the same topics you'll meet across almost every single agency of government for the last 40 years. And we basically have remained at the same level with also a lot of these activities. Agencies, both government and non-government agencies working. I think Flanker, which is well known, when I went there first had 35 different NGOs and aid developments operating within the community. and they did so for many years. I'm not sure that they could measure even with some empirical data, what the outcome was in that situation. We were able to spend a pretty good fortune from government and effectively transform the physical nature of the community. If I will take some credit for that, but between JSC and the Ministry of Housing, you know, the community is literally a new community. But we still have some of the high violence problem. And that's why I said not being in any way cynical, I think the work you're doing is phenomenal work, but I think we need to spend a little time and open up to each other and discuss how each of us see them and see if we can resolve them, because it's not that the country has spent more money on violence violence prevention, as one of my advisors say we should use rather than crime prevention, but anti-violence instead of anti-crime. But if we analyze it carefully, without being subject to our own, narrow view, we have spent far more money on social programs than we have spent on security operations. People handpick the state of emergency and a few things. But for years, not just this government or any government, the governments of Jamaica have spent very little on maintaining any quality policing. And the army we speak of are less than 4,000 men. But we have spent, social work involves the formal institution of education, health, the Ministry of Labour and Social Security, along with the subsidiary like CSJP, PMI. Now add them up. If I just say 10 years, we say 15 years which CSJP operated. Yes, CSJP had a budget of well over $15 billion. The capital investment for the police during that time was less than $2 billion. Right? In addition to that, every single one of these communities have a school that costs the country maybe near $500 million a year to run. Paid staff of maybe 70 to 100 teachers. Then you get to social workers. So it's a little bit, I think I need to see a broader, frank, honest discussion on how we look at these things, because as I said, we have been doing things the same way for a long time. We said, do some more of it. And I don't know why I should really, when I look at some of the countries I've been in, we look at this, I said, education is one I feel strongly about. And for years, we allow the schools in the inner city communities to really run down. And I don't hear anybody speak about it, including the public defender, including the NGOs, and you do parenting commission. But how can you speak of social transformation when the infant school has no toilet, has no running water, the teachers who are there are only those who choose to go there because they can't get a job elsewhere. Nobody pays attention to the standards. The kids roll through. Then the primary school come. Half the kids don't go because they're not interested in the course, which has been statistically proven. After Ministry of Education, 42% of our boys by grade 8 have no interest in what's happening in the school. 10% are expelled. And we don't discuss these things. So unless those are core problems before we get to the issue of all issues you have raised here. Before we talk about peace, safe community, well, every 12, 14, 13-year-old will drop out of school because they have no interest in the curriculum. They don't have uniform, they have nothing. They're going to be unsafe. They're going to create a problem not only for the people around them, but oftentimes the only person they'll protect is their mother. Thank God for that. They still have some respect for motherhood in most communities. But they'll beat their sister, their sibling rivalry. They beat their brother, they beat everybody. And I don't get enough of the focus on how do we spend the government fund. The ZOSO in a particular zone is showing some results. We may not agree with all of it, but every time I look at my crime statistics, for example, the most recent one, you see 1, 2 homicides for the last 5 years in the particular areas. And that's important. Saving lives is important. Can't go beyond that. Denham Town seems to have a little more problem, but Mount Salem, which I grew up right in one part of Mount Salem, since the zone of special operation, I've had 2 murders, and the 2 of them was last year. That's a basic fact. August Town has 1, they were having about 1 every hour at one stage down there. Greenwich Town, it's part of St. Andrew, which was the most difficult area in the corporate area, part of what I call the Southern Crescent. They have had one since the zones of special operations. So, love to see what we're discussing in this committee is the legislation, and I commend you for the very focus on it. The UNDP have also done some that we maybe need to make amendments that will be useful, and we certainly take them on board. If not all of them, a lot of them we'll take on board, and we'll debate the others in different forums, but may even take all. We will have to debate and the committee members decide. But it does provide an opportunity to look at the broad issues of how I prefer to use social investment in our community, because I don't see why I'm intervening in my own community. It's part of Jamaica, it's not a distant land. And I'd love to see that it's an investment in our people and in their quality of life. But how we do it in a collective and empirical way, I think it needs to be interrogated a little bit more, I must confess. But I see Member Paulwell, who has good experience in that kind of, not the kind of issue we want to share, but the reality is that we have it. Some challenges. Go ahead. Ask comment on any of the team members who are presented here. We have the Violence Prevention Alliance, who has done great work, the UNDP, and who's different times that advocate and a partner in issues raised, and of course the PIOJ, who is a principal planning is.
Yes, thank you, Chairman. I believe that all three presentations are. I note your level of frustration because many of the programs we have been discussing have been around for a while, and I do believe that the social aspects are far more important than the policing aspect, and probably we do need to spend far more resources than we have been doing. But I really was very interested, Ms. McCall, right? When I heard that a part of your qualifications is epidemiology, because many of us now accept that crime and violence is really a health issue. And the way we have focused so much on COVID-19, which is right and, to do, is probably the same approach we need to adopt and embrace for what is Jamaica's #1 problem. There's no other problem that affects us as crime and violence. If we could solve this problem, Jamaica's economy would overnight be in top flight. We would have such transformation taking place in education and elsewhere. So crime and violence, which has retarded all of those things, is the #1 problem. And ought we not to change the approach and to see it as a health issue affecting every organ of the body, and how we can, in a sustained way, treat with it as we do with those types of epidemiological issues that we face from time to time. And probably, if we could get some feedback in that regard, it might not be, ZOSO might not be the solution. It might be far more comprehensive and far more pervasive than the 2 or 3 or 4 ZOSOs than we have. I hope I'm not broadening our terms of reference too much, Chairman, but you know,
use the opportunity. The chairman is a little bit liberal to say that, because we deal with we're not in serious note dealing with a very critical issue.
Much obliged.
So once we discuss, you know, while the legislation, as especially done by Ms. Williams, was pretty focused, we do have some room to look at an issue which I think there's still a search for solutions.
Yes.
And that's why I really raised broad issue, because we have done a lot of work, we've spent a lot of money.
Yes.
And maybe ZOSO, if we had enough money to do 100 committees simultaneously, maybe ZOSO would work, but we don't have it.
And I tell you, as Member of Parliament, I've been grappling with this for the entire period of my tenureship. You know, one of the things that I thought about as we were talking about the issue of sexual violence and so on, I am finding, Minister, that you have put a woman in charge of my division. And yes, we've been having flare-ups still, but I find that her approach has been markedly different from the males. Today we had a community walk, and I was amazed at how she was able to relate a lot better to some of those tough gentlemen in our community, and the response that she's been able to get in an area that has a high level of distrust for the police. So I think we need probably more women in the fight, but I really believe it is far more systemic and deep-rooted.
I don't want to interrupt, Mr. Paul. I want to claim that's a new approach the police have. It's in your the emerging police, transformation of the police force.
Well, more credit to you, Minister. But I'm really hoping that this committee could even go beyond our terms of reference to try to find a solution to this pervasive problem of crime and violence in our midst.
Senator Golding, before.
Thank you, Mr. Chairman. Mr. Chairman, I have to join my colleague, Member Paulwell, in that sentiment. One of the things that we have acknowledged, I think, I certainly recall Senator Brown acknowledging it with me on a previous sitting, was the concept that the issues that we deal with and that we're examining in looking at the potential amendments to this act are really multifaceted and are issues that we need to examine in terms of how we can, factors that we can roll out in a sustainable way over a very long period. I recall, I think, was it SDC who said that this is not a 1 year, 2 year. Say again? Yes, JSC, who said it's not a 6-month process. It's a process of many, many years. So I want to join Member Paulwell in that sentiment, and I think while we don't want to expand the terms of reference of the committee, I think as parliamentarians we have a duty to extensively examine the issue, and if what we're coming up with is a band-aid and there is more work to do, then I don't think anybody has to ask us to venture in that direction. But I want to comment, just ask a couple of questions very briefly in relation to the presentation by the UNDP. And I want to thank Mrs. Williams for her very detailed presentation. The brevity of your presentation really belies the substance of it. So thank you very much for that. But, and I'm putting this question both to you and to the ladies from VPA. In particular for UNDP, when UNDP, along with other UN entities, did that multi-country study, the FULU study, I think it was a 2013 study. Did I see that in your 2013? I think was the year. Right. Did that include any monitoring or look at the mental health factors in some of those violence-prone communities? And as a matter of practice, when we go into these communities and we're doing studies about violence and the sources of violence and the impact of violence, are we taking any account of the state of the mental health of the population, both before interventions are made and after interventions are made? Is that a part of the discussion at all?
I'm going to do my best to answer.
Ms. Mago.
Go ahead. Okay, so
Ms. Williams and Ms. Mago.
I'm not sure that every study does that. I know that we have done work on looking at violence against women again, The chair points out that we come back to women, but in those studies, we have looked at the impact of violence on women's physical and mental health. But I'm not sure that in fact, one of the interesting things about this whole area of violence against women is that we actually need to do a perpetrator study. We haven't done one. The women's health study spoke only to women as about their experiences of violence. There is models, multi-country models that WHO and UN Women have used to collect data from perpetrators. So I think if we were able to do such a study, it would perhaps be able to address some of the questions you raised about looking at the mental health and of the perpetrators. But we don't have, certainly when we look at violence against women, we don't have such a study yet for Jamaica.
Thank you. And before VPA responds, if I could, Chair, I just want to contextualize my thinking a bit, because, all week, this week, we've been peppered on the radio with commentary about our violent nature, our men and their participation in violent events against women, but also generally. And I have to say, I've come across families impacted by violence and seriously impacted, murders, very horrific rapes, that kind of thing. And one of the things that they do in their recovery is counseling. And usually the family seeks to get counseling for the victim, and sometimes you have to get counseling for the entire family, and sometimes extended members of the family. But as I listened this week to the media, and I listened to the statistics and the remarks that you have made, I'm just wondering if we are not looking at this problem in a broad enough way. We are a country, Chair, you spoke about systemic was the word you used. I spent 15 years in the United States. The institutionalized rings with me a little bit more. We always discuss their institutionalized racism. It's almost as if we have an institutionalized violence problem. But it is not shocking. We are a country that has come out of a history of slavery, where our men have been beaten, they've had their women raped, their wives raped, their daughters raped in their presence. And I'm not offering this as an excuse. I'm saying that a country that has come out of that has not gotten any counseling. And we have been trying to figure out, how do we attack this problem with the ZOSO? How do we put some teachers in the community to get the kids up? Maybe what it is we need to talk about is the state of mental health of our people in this country. How we attack that mental health problem and throw in all the other interventions, because it cannot be a piecemeal approach. So my question, Mrs. Williams, is in that context, because I'm not hearing the conversation happening from that mental health perspective. Even, I think it was yesterday, as I heard a prominent journalist lambasting our men about their behavior and their violence, and there was a touch on the dance hall music and so on. And then he segued into a discussion about a particular MP and a gift to his constituency. And his response about what the people should tell that MP was itself violent. You know? So we joke violence. It is institutionalized, Chairman, is what I'm saying. So while we're talking about all these interventions, and I agree with you, thank you, that we definitely need to look at this issue of violence against women as it relates to how the security forces interact in the ZOSO communities. But I would love, Chairman, if we could get some discussion from the health authorities about this question of the mental health state of our people and how we treat with that. We're going through COVID. All of these things impact us, but that is the least of it. We've been having mental health problems in this country for centuries, and we don't talk about it. We don't want to talk about it. But I think it's very relevant to this discussion and how we're treating, not just in the ZOSO community, but in the wider scenario of crime in Jamaica. I don't think we can escape it. I'd love to hear what BPA has to say about it.
The zones of special operations is due to focus on small communities with extremely high levels at a point in time. But the principles emerging need to be looked at for the wider, and there is a very critical issue institutionally. We have not changed a lot of the things we inherited as a colonial country. The legacy issues which remain, and the issue of perpetrators, as I said, that's my base. If the men were not killing each other, they wouldn't be killing anybody. We have done nothing to look at how we educate our men, our young boys in particular in our community. They're always left to be rough and tough, but sorry, I don't want to carry it. Ms. McGaw, here with us.
Hi. Sorry, thanks for that, member. We completely agree with you. I don't think anybody on this side would disagree with the issues around mental health, and it's not just ZOSOs, it's a national crisis. The community transformation model that Coyote mentioned speaks very specifically to therapy during crisis management, a community in crisis, and then to healing and reconciliation. And I think that we have to look at mental health in a very broad way. So there's the direct mental health needs of individuals who are victims of trauma, perpetrators of trauma, observers of trauma. And then we need to look at the overall community mental health and wellness. So this is why we talk about things like arts programs and sporting programs and green spaces. All of that feeds into mental health. It feeds into communicating and being able to get these issues out and really get on that path of healing and reconciliation. And yes, we agree that it should be a sort of national effort in this arena. But some of the issues that we're observing have to do with not the types of programs being implemented. They're very strong programs in Jamaica. They're very strong sporting programs. They're very strong mental health programs, youth-based programs. What the issue is, there are a number of them. One has to do with sustained interventions. We do not sustain the interventions over a long period of time, and we have to treat social interventions as a permanent fixture. They are not 2, 3, 4, 5-year projects. They have to be part of the permanent delivery to our communities. Coyote mentioned that you can adjust the doses, right? When a community moves out of crisis, yes, you can adjust the doses, but you can never stop a sporting program for young people. You should never stop arts-based programs for people who have issues communicating. So the sustained interventions is one big issue. But then how do you sustain interventions? You have to make them sustainable. To make them sustainable, they have to be community-owned interventions. They have to belong to the community. The community has to drive it, hold it accountable, and really be the ones that are responsible for the results. And we had that for many years. In recent years, we're seeing a little bit of a move from that, and we have to maybe look at why. Whether it has to do with a lack of resourcing to communities directly, the ones in communities making the changes, the CBOs, the NGOs, and so on, delivering the work. Then the other thing has to do with the evidence-based, right? So small organizations, CBOs, community organizations in communities, obviously don't have the technical expertise nor the resourcing to go and do effective, in-depth, multi-year monitoring and evaluation. And I was really happy to hear about the PIOJ tool that they're implementing in their CRP communities, which allows anybody in those communities to feed their results into that tool. And I think if that can be looked at as more of a sort of national tool for communities, so that you get this national database, so that it's very basic metrics that we're looking at, that you don't have to have all these sort of levels of sophistication, but it is some basic information that feeds into that maybe can support the monitoring and evaluation and this evidence-based approach, which I know is a big issue for NGOs and for being able to continue to prove the effectiveness of the work. So those are sort of my points with regards to that, and I know that Tariq had a couple others.
Hi.
Thank you.
Mr. Chair.
Sorry, hi, good afternoon, everyone. Just a query, just a little clarification regarding the model that KOD presented earlier. I mean, this model that we were looking at is specifically a snapshot suited for something that a community is in crisis. In no way we're saying that it is linear, as KOD said, but we also recognize there is a build-up of many other programs that have been occurring in Jamaica, a number of activities as well. But key, we cannot dismiss from any community in crisis some critical areas. For communities like Denhamtown, Trenchtown, Augustown, we have seen the need to build trust in those communities, first and foremost, between the police and residents, but also between residents themselves. And this is very critical for the issue of collective efficacy. All of the things that we want to achieve in terms of ownership, collective efficacy as we understand it, which means that informal social control and the pressure on activities in the community that may be illegal to help foster a sort of change that we want to see in the short term is very, very important. You want to have the trust building, but you can only achieve that, members, if you start with a trust building process. And that trust building process, the ceasefire, I see that people may have shunned the ceasefire idea. This is, or the interruption idea, in fact. The interruption idea is not to be treated solely as a very strict idea of making peace treaties between gangs. You're interrupting because you want a particular change in the community, and that change has to focus on a mixture of ingredients, one of them being a strong deterrence framework. We spoke about different security actors coming together. What we noted in the ZOSO, for example, legislation is that, I mean, you won't be able to affect changes in Denhamtown, for example, if you do not address issues like asset forfeiture, right? You do not deal with the issue of street-level offenders and also criminal market offenders, right? These are two different levels of offending in the country, and there may be more. But you have to be able to look at the issue of trust building within the model that we've suggested. Look for the actors that have the competencies in it. But you also have to support an idea of a strong coordinating mechanism. And that coordinating mechanism that we've spoken about is the PIOJ's work. The Community Renewal Program, I sit on that expert committee as well, and we've done tremendous work in putting that index together, right? But one of the key things is bringing all of these actors, and they've been able to look at interstate agencies and interstate actors as well, coming together regularly to meet and discuss interventions in those communities. So what we've been missing for a very long time is a strong coordinating network, a strong coordinated framework. VP has been doing that. On the matter of mental illness, Safi mentioned we can speak about it more broadly. Just very quickly, I mean, VP has been actually advocating from since the time I was part of VP, 2008, for an approach to mental illness, particularly looking at grief and trauma management. We also used to show a video, I think Dr. Walker probably still make it available, on Seeing Red, right, which looked at the issue of cognitive transitions because of the exposure to violence. So mental health has always been there. It may have been a bit, not at the forefront, but it's something that has been on the table for a very long time. In a more chronological sense, CSJP and the other partners here who would have worked on violence prevention for the last couple of years would have had to be administering a case management and a youth violence instrument or youth violence prevention instrument. So that would have picked up cognitive deficits, right, cognitive changes in individuals that make it difficult for them to determine right from wrong, right, and this type of label. So the mental health aspect is there, right? The focus on it is there. It may need to be scaled up. It may need to be sustained. We need to get more organizations, right, involved and understand the importance of it and addressing it very early if they are going to intervene for youth violence prevention. So I just want to point this out. You're looking at a model that is a snapshot. You're looking at a model that has been developed for different interventions, but you should not be too, or allow some flexibility regarding what it is suggesting, especially in terms of interrupting. Because the interrupting here, I know you may get a pushback because you think of PMI and other actors like that, but it's more than that. It's more than that. You want to stop, right? And one of the things that I finally say is that we believe that certainly from a criminological insight, ZOSO gives us an integrated method, integrated philosophy. And this is what we need to capitalize on, right? That integration of methods and approaches. So you have suppression, you have your prevention, and you have your interruption models, right? the Act allows that to happen for Jamaica and should be pursued in a way that strengthens coordination, right, amongst what we have already. So build on that. So it can do that. It can do that, but it requires the proper mixture, the proper interaction between different components and ingredients coming into the mix for it. Social intervention cannot be left out of it because we understand empirically the importance of peer influences on criminal outcomes. We understand the importance of investing in child management practices to stop poor academic outcomes that leads to criminal justice contact later on in life. So I want us to think about ZOSO as that integrative tool, right, that requires a stronger coordinating mechanism, right, a little bit more actors involvement, and appreciation of things like what UNDP spoke about going forward.
Thank you very much. Just two quick comments as I see. I don't see that hands up yet. But one, let the chairman be a little bit progressive to see that. I don't like the word mental illness. I tell you why. And I know what you're trying to get at. I do appreciate the need to begin to look at what I prefer to call emotional states because, you know, at one time, the authorities think God was a madman. And so Garvey, of the day, authority they thought God was mad. It's something I don't like government getting into defining mental state. You begin to get all kinds of queries. But I quite understand the meaning in terms of looking at emotional situation there, which has to do with what we may call in medicine mental health. But I don't like governments beginning to look at mental health state because everybody have a different view depending on who's in authority. There are many people who have gone to prison for being mentally unstable because they disagree with the government in several societies that are established. But I fully understand we need to look at this, what emerged in these environments. And certainly, you know, the United Nations, I think, defined anything above 10 murders per 100,000 as an epidemic. And we have had that epidemic for a long time, and we need to look at how we deal with it. But I just want to say to my colleague, if we're allowed to treat it like public health, that could solve the problem. You cannot treat it like public health. And I'll have the same people knocking me up tomorrow morning. The fact is that the principle of public health, as practiced in COVID, very simple, you know. Identify the infected person, the perpetrator, say, call the gunman, you restrict his movement immediately and indefinitely without court, and you find all the people you're in contact with, which means the gang members, and you charge, and you confine them as well. You restrict their movement without any question. Even provide them with food. And if I could do that for criminals, I could stop the gangsters. I know all of them. Everybody in Jamaica knows the gangsters down there. If I cannot detain one even who has committed a crime for more than 48 hours. Otherwise, I get sent to court for breaching the Constitution. It has been used over and over, but the parallels don't work. The epidemic is the way we treat people.
Chairman, please, I beg of you, don't misunderstand my point. I'm certainly not advocating a 1984 Orwellian state here at all.
I said, I quite understand they do, but I'm just saying I don't like the other way the government start defining mental illness. But the epidemic issue is substantial. We have to look at how we treat this community, how we work in this community in a holistic way. Two things that I have not heard much mentioned of, and I go back, I've mentioned it before, and I think it's worth repeating. One is, you know, Capri said made the point that we do a lot of social investment and work without doing any kind of empirical analysis. And we start with very weak databases and then we do a lot of nice things, but we don't do things that are based on any kind of, you know, the data is short in almost all areas. POJ is trying to do that, but pretty much everybody does things, and it is nice sounding events. CSJP, for example, have no baseline data to work back onto, and they spent 15 years and billions of dollars, and there's some of the data which are really not in the interest of a good project, but it was a well-intentioned project. I think I'd like to see some more discussion with this cost intervention. What are the outcomes we want? What do we have? The issues some was raised by both, all of you entities, including POJ, poverty levels, single-parent levels, and one of my colleagues, one of us academics don't use the term parent. We have a lot of bearers of children, but they don't function as parents because the conditions are so bad. The quality of housing, the unemployment skills. So we need to have more of those baseline data. So when we finish, we can say those have been eliminated, and you begin to get community members being truly community leaders. because it's, last thing I meant is that nobody discussed leadership, because this idea of just, say, a community buy into it, you know. I find it a bit challenging, having worked in these communities for a long time. A person who has no meals, no source of income, you ask him to become a community leader, but he gets up every day, and this is real. He lives by walking around the neighboring middle-class community to see whose yard need cutting and get yard cut. So at the end of the day, he doesn't go out, he might not get to work. The mother, if they are together, lives by washing clothes for somebody, and they have to wait. They check everybody every week, every day, to see who has clothes to wash and gets the money. And then you ask him to become a community leader, attend a meeting at critical times, come to some studies on parenting, when what his counsel for parents that he need to find the food for his children. And you want him to sit in the classroom for 2 days with you. When you finish, you see, you graduate him. It's something you look at. Leadership is accountable leadership in the communities who can carry the weight is critical. And it does involve to what I find that is referred to very often in the courts as to what is permissible in a democratically elected, the fundamental right. That's a chapter that every person in the Charter of Rights, right? But how do you hold democratically elected leaders for? You walk into a community, and a lot of NGOs say, well, I don't want to see the councillor, the politician, they're not political. I don't want to see the MP, because he's a politician. But they're democratically elected. And everything you raise, like I raised in society today, that is not permissible in a society run by a democratically elected government. It's not the responsibility, it can be done. But democratically elected leader seems to play no role in the whole process. It's something I'd love to see explored some more, because I find that in these communities, more often than not the first port of call and maybe the only credible port of call for the community members are the people they elect, because they're the only one who need to listen to them. Many others don't listen, from teachers to police officers to social workers. You know, I still had the unfortunate experience of a social worker who, at a very institution that I had to have interest in getting going, a training institution, were there to get the people, give people a second chance. And when she has started having some trouble, and she was a seasoned, experienced person, fully qualified, masters in social work and all that kind of stuff, and many years experience. Got a little pushback in class. Got up and tell the class, well, she's not busy, you know, because pure Dr. Chang prostitute and gunmen in here. Well, my response to that was what it was built for. And she left after that. I was quite happy to see her go. And I said, you know, holding leadership accountable, but what kind of leadership is I think is a big part of getting these communities to buy into programs. And I'm not saying the politicians must be given certain leeway. I think they could be held accountable, because they have to provide leadership. In a lot of these communities, you're not going to get the effectiveness you want. If I go to East Kingston and go up to Warwick and call for a meeting, you may get a meeting and the 10 nice people come, because that's who they want to come to the meeting. And you'll have wonderful work there for 6 months, a year. If you don't get Mr. Paul to go down there with you and call all the people he knows that is required to come out and begin to identify the broader member of the community who can work with, you're just going to have someone who will live off the NGO for a while. And the crime continues. That he knows who, and he's not going to turn an informer, but, right? He knows who needs to be removed from the community to ensure that there's safety, not negotiation. Trust me, that's one word that I even listen to the debate. And that negotiation about they kill people. A man who kills people is a murderer, he must go to jail. No ambiguity there. Man don't go out and fight. What I must do is remove the illegal firearms, access to illegal firearms, and give the young one who have not yet killed somebody a chance to live a decent life, which means I give him respect, offer an opportunity to be trained, and to try and get into his head, as suggested by that he is of value to society. He can hold his head high, feel proud about himself as a young man, a Jamaican, who can have a stake in the society, protect his brother, protect his sister, and build himself to something that is productive, useful in society. Get all these things. We don't need to pull a gun, which is easy. 2 ounces of pressure to kill somebody to be powerful. You can be powerful. Just get that in the head. As many Jamaicans are, we are proud of our musicians, our athletes, our scientists. They're world beaters. You know, Bolt is the #1 athlete in the world. Bob Marley's music exceeds, his income exceeds that of Bob Dylan in some years. Jamaica, that's the Jew of Jamaica, and we need to get across the hill of some of these people. But, sorry.
Chairman, if I could just interject here, because I think you have, the last comment you made is really supporting the point, and I want to expand a little bit on it, because I don't want it to be an incidental part of this discussion. And I hear you on the issue of government getting involved in the whole mental health, intervention. I'm not necessarily suggesting that government be involved. And certainly the definition of what is mental health and what may be defined as a mental health illness is not controlled or determined or defined by government. There are agreed definitions about it in the scientific community, in the medical community. And I also want to make it clear that I'm not talking necessarily about the most extreme mental health issues either. I'm talking about things that fall below that have a deep impact on us in terms of how we relate as citizens. The very issue that you just raised, the relationship between community members and the member of parliament, the representatives, the political representatives. In all the time that I lived in the United States, I never ever saw a political representative come to my door, and yet my garbage was taken up, my streets were clean, the lights were on, and when they went out, they went back on after a time. Somebody administered to that. If you had a problem, you wrote to your representative, and there was a response. But in a scenario where we have historically had an unhealthy relationship with political representatives, and the structure of that relationship has impacted how we have organized our communities, we really have to look at not just the extreme schizophrenia and borderline personality disorder issues, but some things as basic as how do we see ourselves? How do we view ourselves? I tell my 13-year-old son all the time, when you're walking, look up. There's nothing you're going to find on the ground that is good for you. Look up. Look in the sky, walk ahead of you, see who is around you, interact with people. It's a function of how they're viewing themselves. I'm trying to build his confidence and sense of self-worth, but there are lots of young men in the community, and you see them, the shoulders are crunched, they're looking around you. If they're talking to you, they can't look you, they can't make eye contact. I'm talking about those kinds of psychosocial issues that require the intervention of mental health professionals to deal with our state of mind. And then we can address these issues about how we organize, how we relate to our women, how we relate as a community. It's not just, I don't think we can leave the issue of mental health out of the picture. And so I want to make that point very stridently, Mr. Chairman. May it please you.
I want to just make that I support essentially what you're saying. I'm just saying that I kind of just raise a red flag in terms of don't government get involved in determining and defining mental health, because certainly the question of self-respect, self-worth, confidence, is something that is crucial to building sustainable reduction in violence in our society. We have too much of a belittling of our own people, ourselves, where young people, especially young men in the city, feel that they have no stake in society. And that destroys a lot of the value system, and it creates the basis for extreme violence. Sorry, I think Ms. Williams wanted to come in, and you're here, I'm here all the time, so you.
It's okay. I just wanted to make a comment around this whole matter of mental health, and not to belabor it, but to say that some of the things that we're perhaps putting in that category, because I heard the members speak about they're cultural. And so there are things that we can change about the things we believe and our practices and our behaviors. So these are things that with the right approach and with time, we can shift some of these thinkings. And I had to make that point because, you know, when you look at violence against women and girls, and yeah, it's my wheelhouse, it's not just men who are mentally ill who abuse women. And so a lot of that attitude is based on things that we have come to believe as a society about that relationship between men and women. And, you know, we know the whole thing. But it is something that we can change over time. So it's cultural. And we always caution that, you know, we don't want to say that men who abuse women all have mental illnesses. They don't. I mean, they just believe things that cause them to think that they can impose their power on women. And that is not, you can have bizarre beliefs without being mentally ill.
Yeah.
What's the kind of intervention that helps to correct? How do you change a cultural view?
That's probably the million-dollar question. But the truth is that it is with sustained prevention measures over time, and a sort of re-education almost, and it's re-education for people who have come to believe certain things, but also the prevention part of it really starts from a place where we don't allow children to develop these attitudes. We model different behaviors, which is why we speak about family violence. Because violence in the family models violence for children. And it doesn't just model violence, it models these notions of who has power and who can, and I'm not just talking about violence against women, I'm also talking about violence against children. We don't talk a lot, for whatever reason, about this whole, how damaging corporal punishment is and what it teaches children. And what it teaches children about the use of violence as a dispute resolution mechanism, and how that transfers to their activities among each other and in the community, not just in the family. And, you know, the chairman spoke about us having real conversations about some of these core issues, and I believe that violence in the family is a core issue. And violence in the family is not just about the intimate partner violence, it's about violence towards children as well in the family, and how that predisposes us for a culture of violence that then manifests in our communities and in the wider society. We train our children that violence is a way to deal with things. And for whatever reason, we haven't yet been prepared to really tackle head on this whole matter of corporal punishment. But we need.
Thank you. Look, I think we need to spend the time discussing the issue, but I think we have had some very solid suggestions to look at the legislation which is why we're here, and I want to thank all the members who have contributed. The PIOJ know we're in touch with them among various issues. I would say that we are looking currently in the Ministry of National Security Crime Prevention section of how not only to continue to expand zones of special operation, but to introduce what I call longitudinal programs that seem to look at the males in a society in a particular way. I've spoken of it, the term I use, and I do the reverse. I say I want to engage them from age 20 to conception, right? Because somehow we have to find a way to begin to not only to provide the case management and alternative behavior and counseling for those 16 to 25-year-olds who are pulling the trigger, and those who some will end up in prison, but we have to deviate, provide alternative to those. But we also have to begin with them from the mother who is really a bearer of a child and not so much of a mother. Struggles, she gets pregnant and she ends up in clinic. She doesn't know what she's going to, when she's going to buy baby clothes. We need to find them at that stage and begin to give them some kind of security in their life and give them, remove the social exclusion and give them what the anthropologists call on some level of ontological security. That if, they begin to realize that carrying this child, maybe the last one she'll carry, but at least she's in touch with society that is beginning to keep her on some pathway that gives her some security about life. And if it's a boy or a girl, at least they get out and get proper public health care, get into a decent infant school, get onto high school, and begin to. Life is transformed. So the institutional change is required. We have to start the process. And I think Senator referred to it. Institutional changes have to be made along the way, from public health to school, public education, especially in these communities. Well, I want to thank everybody for their contribution today. The zones of special operations designed for the high incident areas, but violence is the underpinning cause of a lot of this issue, and we have to work at it, and as a country, collectively, and take responsibility as well in a collective manner. We can adjourn early today. It's 4:15, but I think as Senator put it, the brevity of the presentation belies the substance that has been outlaid here today and the strength of the discussion. Let me thank everybody for the excellent presentation. To my colleagues, our next meeting is set for the Thursday the 15th. We have had to move out on Wednesday because we're having double-day parliaments now, Tuesday and Wednesdays, and Fridays. So we're going for Thursday 15th at 10 o'clock, and do as much as we can. I'm going to also move a resolution next week to be allowed to have some of the meetings virtually. Especially when we're having a review of the matrix, we can do it virtually. But when we're having the presentation, it can be useful to have our members here, and we have some interaction, not only on the presentation, but in discussion. Again, let me thank everyone for coming. UNDP, VPA, and of course, PIOJ. Like the poor, they're always with us, but they're not so poor.
Chairman, could I just make one request before we go of the UNDP, and forgive me for being a little bit lazy. The second and third papers, the Capaldi paper and the Fulu paper, if you do have copies, would you have them sent to Parliament so I could take a deeper look at those two papers, please? I would be very, very grateful. And Chairman, I just want to echo it. I really appreciated the presentations from all the members on that side today. It really, really was a lot of stuff packed in. Thank you very much. You've given us some homework.